Hi everyone. I am recording another video because there are a lot of things about Amity in the last week or so and moving forward that kind of just build. So it's a lot of tinier things that are happening over a period of days that just end up turning into huge giant things, which is kind of often the case with everything that happened with Amity so far, I would say. So I just thought maybe it would be easier to do a video instead of tiny little snippets for posts. I'll still post her pictures because she's an angel. Oh my god, she's so cute. I can't. It hurts to look at the pictures from the hospital, knowing all of what we were going through. And honestly, not even we, but her, all of what Amity was going through, it was very tough for her. And so it was very challenging for me emotionally to look through those pictures and videos and remember what she was experiencing in those days. But I'm just going to kind of take us back to October 9th when we found out about what Amity was diagnosed with, because I think that that's really the day that things started to seem like they were maybe not going in the direction we wanted them to, or we were experiencing a lot more woes, difficulties, and challenges from the day that she was diagnosed moving forward. So also, I'm in Arizona. Woo! That's where I'm filming from today, or recording. I'm not a content person. I don't know what I'm talking about. But this is where I'm recording, in my in-laws' front yard. It's beautiful here. You can't really see the mountainscapes in the background right now because I'm a little bit too. I'm not in the right direction. But I needed shade for this. So, okay. So going back to October 9th. October 9th, 2020 is when we found out about what Amity's diagnosis was. And for those who are maybe not knowing anything about our story and just happen to see this video, I'm Jackie. I'm the mom of a beautiful baby girl named Amity, and I'm just telling Amity's story. She fought a brain cancer, a very rare and aggressive brain cancer, at a very young age, and has recently left me in May of 2021. And so I'm telling her story and I'm sharing it with everybody to keep her alive in any way that I can. So October 9th, 2020, we were told about Amity's diagnosis. I did share a post briefly stating some of it, but I'll just kind of tell you a little bit more about that in detail. So I was getting cleaned up, and Dr. Ramdas had come into the room, and so it was just Anthony and Amity at the time. And the first thing out of Dr. Ramdas's mouth was, "I'm so sorry, it's not good." And Anthony has said to me time and time again, he will never forget the way he came into the room and shared that information, because it was a real realization for him in that moment that we are freaking up against it. Amity is fighting something that we wish it wasn't, right? If anything, could it be something different? But no. So those words really stuck with Anthony and were kind of ingrained in him for forever, from that moment. So he kind of explained to Anthony what it was. It's a grade 3 anaplastic ependymoma tumor. Ependymoma tumors, there are varying ependymoma tumors. They're in grades, not stages. So that's something that's different. People are often confused about that a lot of cancers go by stages of that cancer. With ependymoma tumors, it's grades. So you can have a grade 1, which is just a benign tumor. It's something that's easy to remove, no cancer associated with it. There's grade 2. Grade 2 is maybe meets some characteristics of cancerous tumor, but could very well be not harmful and easy to remove. Or there's grade 3, which there's no question about it, it's cancerous. And so Amity was grade 3, and she had an anaplastic ependymoma. Anaplastic is a very sticky, jello-like tumor, and so a lot of tumors, in the way that we all think about them, right, is, or at least those who are not experts in cancer and tumors, the general population of people, understand tumors as being these solid masses that are just growing, maybe growing up into different areas depending on where the tumor itself is. But an anaplastic ependymoma is very gelatin-like, and so it wraps itself around tight. It gets into all the crevices. It's sticky. It's very sticky, is what we've been told. So it's a real. It's real tough. It's a challenge to overcome an anaplastic ependymoma tumor. So Amity was giving Anthony a hard time, as per usual, just because she was uncomfortable. She was fussy. It was a lot to take in all of what Dr. Ramdas was sharing while Amity was uncomfortable. So, and I wasn't there. So Dr. Ramdas said, I'll just come back in the afternoon. That way I can talk to both you and Mom, and we'll have one of the nurses just wagon Amity around in the hallway since she loved the wagon. And that way we can focus on what it is that we're really dealing with. So fast forward, Dr. Ramdas comes back and he explains everything to us. And basically what we end up finding out is that there are degrees to which the anaplastic ependymoma 5-year survival rate is measured. Okay, and the first measure is by the subtotal tumor resection. Subtotal tumor resection means that you have gotten some of the tumor, not a lot, not all of it by any means. You've gotten a sub amount of tumor out. If you've achieved subtotal tumor resection, there's a 30% chance of a 5-year survival for that child, which means that Amity, because if you can recall, she was at a 40 to 50% tumor resection, which means she was in the subtotal section of bracket of that category, which means that we were not looking at the good percentage of survival at this point. We were in the 30%. Of course, that's varying because this is, based on however many studies were conducted and different tumors, different children. Everything's always different, but generally speaking, it was a 30% chance of meeting a 5-year survival rate. If we were to achieve a near total tumor resection, which is the next level up, that would be a 50% chance of a 5-year survival. And if we were to achieve gross total tumor resection, which means that they have gotten as much of that tumor out as they possibly could, and the MRI scans will come back reading clear, so no tumor detected, would only bring her up to about a 80, possibly a little bit more percent chance of a 5-year survival. So any way you flip the script, we're looking at never meeting 100%, right? So here, my husband and I are in this position where we have our beautiful baby daughter who we're just finding out has a brain tumor, and now we're hearing that the tumor she has, in any picture, in any scenario, has a 100% chance of meeting even a 5-year survival, let alone 30, 40. She's gonna watch me grow old and pass the way it should be type of scenario. So that's very, very, very hard to hear. Very hard. So, okay, we get all this information. Next, we're finding out what the standard treatment plan would be for treating an anaplastic ependymoma tumor. These tumors are tough because they're so rare. And in previous posts I've shared, only 200 children in the United States a year are diagnosed with an anaplastic ependymoma. So Amity was one out of 200 children in the entire United States who would unfortunately be diagnosed with this type of brain tumor. So what that means is that treatments, trials, and all these other things where we're trying all kinds of different types of treatment plans don't really exist for ependymoma tumors. There is a standard treatment plan, and the standard treatment plan is tumor resection surgery, which Amity had September 30th, her first one. Next would be chemotherapy, followed by a second look MRI, a full scan, followed by a second look surgery, and if it looks good to remove some, which makes it a second tumor resection surgery, followed by radiation therapy. Now, chemotherapy has not been shown to be effective for treating ependymoma tumors. The reason why it's so important for Amity and her treatment plan is because it helps to postpone the start of radiation therapy until you're at least 1 year old. Now, in the UK, I believe they don't start radiation therapy until children are at least 3 years old. So they may continue chemotherapy treatments for an ongoing period of time so that they can get to the age where radiation therapy is appropriate to begin. In the United States, I believe it's 2 years old, but definitely not before 1. And so what ends up happening is you need to weigh out your pros and cons, right? Cost versus reward, cost versus benefit. And in Amity's situation, it was, we need to get her, we're talking, it's October 9th now. Amity's birthday is November 29th. So we need to get her to her first birthday in order to determine whether radiation therapy should begin or if we should be postponing radiation therapy and continuing chemotherapy treatments. For those of you that don't know, we never made it to radiation therapy. And so it's a really tough thing. It was definitely on the table. That's what we were going to do. She turned 1 and that was the plan. We didn't make it. But radiation therapy is the second most effective way of treating anaplastic ependymoma tumors, second to tumor resection surgeries. And so Amity had 2 tumor resection surgeries, but like I said, we didn't make it to radiation therapy. And so I am curious to know, I wish I could go back in time. Of course I wish I could go back in time because my daughter would still be here with me. But we're often constantly questioning if we could have made it to radiation therapy, would she still be here? Probably. So that's tough to come to terms with, that we never made it to the last step in this standard treatment plan that we had been given as the ideal form of treatment for Amity. And so this treatment plan actually had been, I apologize. This treatment plan had been approved. Again, it's a standard treatment plan, so most children are receiving the same treatment plan, but it had been sent out to CHOP and to St. Jude's for their opinion on what treatment plan they would use for Amity in particular, and both CHOP and St. Jude's said this is what we would do if Amity was patient here. So we knew that what the treatment plan that Amity was getting was exactly what 2 of the other most amazing hospitals, from what we hear, focusing in a lot of cancer treatment, would also have given to Amity. So for anyone who feels like we should have gone to CHOP or St. Jude's or any other hospital outside of Geisinger, we were given opinions by all of those doctors on Amity's condition, and we felt like we were making the right decisions for her. So don't come at us. So that's a lot of information in one day for us to be given on the 9th. And but the exciting part for us was that this meant the treatment plan is going to take form now, and we're going to start doing something outside of just letting her recover from this brain tumor surgery that she had just had 10 days ago. So we are just sitting tight with this, really. We're hanging out in our room just the same as we would do. We're still stuck in 391, which I've shared in the previous post. 391 is the worst. We hated room 91. It was just so tough to be in that room. I don't know what it is about the bad juju. We did not have this situation in any other room that we were on Children's 3, but God, 391 just, we were in there twice and both times were miserable. So we're just hanging out in there. And Alex, one of the neurosurgeon residents, had come up like, I don't know, 3:30, 4 o'clock-ish, and said, hey, how would you guys feel about going home today? And of course, my husband and I are jumping on this conversation like, heck yeah. Let's get out of this hospital. It's been 10 days. I've only seen Brody for 2 hours out of this whole 10 days. Our dog and our cat, and Amity's been trapped in the hospital. We haven't seen the sun. I mean, yes, there's windows, but I mean like fresh air, baby. let's get out of here. Absolutely. And he said, you know, we're comfortable if you're comfortable. How is one to know how comfortable they would be outside of the hospital when they've never been outside of the hospital after having a brain tumor surgery? We were so naive. And I will tell you that these few days that we would have at home would be the absolute most difficult days. One of a series, honestly, truly. But very, very, very hard days of Amity's life, I feel like. So we're like, yeah, we want to go. Absolutely. What do we need to do? I had pointed out, and maybe you may or may not notice these this lump in pictures that I post, but Amity had what was called a pseudomeningocele. And so what it is basically like a pocket of fluid. And so when she had that EVD, which you might remember from my previous videos, to help drain off some of the excess CSF that she had that wasn't reabsorbing into her body, and then that got pulled out and sutured. Well, what happens is that sometimes the skull, or the dura seal is what they call it, so it's like a real thin layer of, I imagine it as like a thin film. I don't actually know what the material is. I just know it's a Duracell is what it's called. Under the skull had not sealed. And so what that meant is that there was basically like a leaking faucet. So she had a slow drip coming through the Duracell out the skull and then just pocketing underneath the skin of her head. And so what that meant was that because it wasn't healing, it was slow drip, and the fluid has nowhere to go, it creates what's called a pseudomeningocele, which is that pocket. And so it's just starting to fill while we're in the hospital. And I had mentioned to Alex, hey, is this okay? You know, because now they're talking about us going home, and I'm starting to notice this little lump developing outside of her head. And he felt it. It was soft. That's what you want. You want it to feel like a nice cushiony pillow. When it gets to be too firm, that's when it's not good. And so he felt it and he said, nope, I think this is fine, everything's good. So they sent us home. Okay, so let me just tell you, the first issue about going home is that, one, we've had an NG tube in for days at the hospital, right? They put an NG tube in, I think, 2 days after her surgery, which means that she was being fed through her nose. She was being fed through an NG tube, dropped down into her belly because she wasn't really taking fluids by mouth. They sent us home without an NG tube, okay? So do you know how trying that is to have your 10-and-a-half-month-old who just had brain surgery, who hasn't really eaten well to begin with, who's now been fed through an NG tube at the hospital for at least the last 7 days? Do you know what that's like to try and feed a baby at home after all of that? It's tough. It's extremely difficult. And so, sorry, there's dogs barking now. And so what happened was, sorry, they're everywhere. We struggled to get Amity to eat. The video of her ravenously eating that pasta salad, which, by the way, oh, it's the cutest little thing ever. God, she's so cute. I can't even handle how cute she really is. Oh my God. That was like super rare, and I'll tell you, that was about like the only thing she ate that whole weekend that we were at home. It was so torturous. We couldn't get her to eat. Two is that she had been getting all of her pain medication through her NG tube as well. And so, I mean, the dogs, honestly, like, what the heck? And so what happened was, she is now having to take medicine by mouth. I can barely get the kid to eat, let alone take fluids, and now we have to try and manage her pain by giving her medicine through her mouth, orally. And that was just, we were literally set up to fail at home, is really what ended up happening. We were set up to fail, and we did. Amity was in so much pain all weekend. She was extremely uncomfortable. She barely slept at all. She cried basically the whole time. Anthony and I were like, what do we do? Honestly, we had no idea what to do. We had absolutely no tools in our toolbox. We were freaking out. I mean, we're trying to put medicine on a spoon and trick her into thinking it's food, but then it's like she doesn't want to eat food anyway, so why is she going to take it off a spoon? We really struggled, and we were pretty upset that we were sent home the way that we were sent home, especially because we're new to this. No one just turns into an expert on how to care for their baby who has seriously, very new, serious medical needs. It was very challenging. So we had a really tough time. So October 13th, we were going back to the hospital for a G-tube and Metaport surgery. And we knew we would be there for 1 to 3 days at minimum because of the healing time for a G-tube surgery. And we said when we go in there, we are not being discharged until we actually know how to do what it is that we need to be doing at home, and to be given all of the resources that we would need to help manage Amity's care without the hospital. And so October 13th came. This is a Tuesday. Now, for anyone who doesn't know what a Metaport is, it's basically a small device, not so small for a baby, 10-month-old, because it sticks out a lot. But it's a small device that goes into the chest and comes up into one of your main arteries. The catheter drops down into the heart. And so instead of getting a peripheral line put in for treatments or for fluids, anything like that for IV, you get accessed right through your Metaport. Now, it sounds so grandiose, right? Like, that's so much easier. While, yes, it is easier because you're not having to find a vein. It's literally cathetered through one. Getting accessed is miserable. That's another story and not at all related to what I'm talking about right now. But getting accessed, it's a little butterfly clip that has a needle that just stabs right through the skin and goes into this Metaport device. And then that's how Amity will end up receiving all of her chemotherapy treatment, any IV fluids that she might need, any antibiotics that she will eventually need, because the poor girl just always had speed bumps in the road. But basically is everything, right? The Metaport was so important in Amity receiving any of the treatment that she would end up needing, especially for sedation, things like that. So October 13th, she was getting the Metaport. Additionally, she was going to get a G-tube placed, which is a gastro tube, and it's basically just a tube that goes through the skin of the abdomen and into the stomach. So a hole right through the stomach, and it's a tube that you just feed through. And the reason why we were told this is so important is because chemotherapy, which everybody knows this is not new information to anybody, I'm sure, but that chemotherapy reduces appetite. And for Amity at 10.5 months old, making sure she keeps up on her nutrients is so important, right? Because it's not like she's a 27-year-old young woman who has some chunk to her or anything like that. She's 10.5 months old, so it's absolutely adamant that we keep her nutrients up by feeding her any way that we can. And NG tubes are not ideal for long-term use, because if they pull them out and they'll have to put them back in, which putting them back in is easy, but every single time she would need to get an x-ray done to verify that the tube itself has not punctured through the stomach lining at all, and it's just sitting in the stomach perfectly. And it's not good to put them through many x-rays like that, because it is very easy to pull out the NG tube. Again, my husband and I were learning. Unfortunately, there was a lot that we didn't know, and if I could go back in time, I would have absolutely fought tooth and nail, my husband too, to not have a G-tube placed at all. But we didn't know any better, right? And so we get this surgery done on the 13th of October, and Dr. Kennedy comes in. We're in PACU now, which I had previously mentioned PACU before, and how it's the place where you go before and after surgery. So you go before there to prep for going into the OR, and you stay there afterwards for about an hour to recover after the OR. And so we're in PACU, and we meet Dr. Kennedy, who is going to be doing her Metaport and G-tube surgery all in one clip, right? We're not very big fans of general pediatric surgery. Dr. Kennedy, he's nice, very nice guy, but we suffered not we, again, Amity suffered a lot of problems that would continue to build all through the end of January into February, regarding these surgeries that Dr. Kennedy did. So I don't like him as a surgeon for my daughter. Him as a person, plenty nice. So we meet Dr. Kennedy and we sign our consents, and he gives us the spiel. You have to say all what we're doing today, things that could go wrong, and at the end he says, we do these all the time, right? And I believe that, absolutely. I'm sure there's plenty of children who are sadly receiving chemotherapy treatments, and there's plenty of children who are not able to take food by mouth, and I believe that 100%. And he said, it's fine, it's gonna be easy, quick, one and done, don't worry about it, everything's gonna be great. Okay, great, super. So she gets out of surgery, and just as he said, everything went fine, which again, super. So I don't know if anybody's ever had their children be put under anesthesia, but something that happens quite frequently is that when kids wake up from anesthesia, they're freaking out, right? So in the PACU, you're separated by curtains, not actual walls. And so there was a young boy next to us, I don't know, maybe 3 or 4, and he woke up from his anesthesia, and he was screaming. I don't know, he was uncomfortable. He thought he was in a different place. He was freaking out. All the while, Amity's just sleeping like a little angel on me. I couldn't even believe it, because this boy was just screaming at the top of his lungs through a curtain, and she just slept. And so as soon as that boy settled down, Amity decided it was her turn. And so she was bloody murder. I mean, I have never heard Amity scream the way that she screamed this day. And my husband and I went into full-blown advocate for her. She's our daughter. Someone's gonna get her help. Okay. And so PACU got to see us. Well, they've never met us before to begin with. So these nurses, the Condors are new to them. This Condor family is all new. And they got to know us in a way that we don't often present ourselves. But when your daughter is screaming in agony and pain, you're telling wherever, that someone needs to do something now, because this is ridiculous. Well, there's no morphine ordered for her. There's no oxycodone ordered for her. We already gave her the Tylenol. There's nothing we can do. Are you freaking serious? Do we not see what's happening to my daughter right now? I mean, Anthony and I were just enraged, right? Our daughter is screaming at the top of her lungs, flailing herself around, literally trying to get out of her body. It was as though she was in so much pain that she was trying to escape. Like, I need to get into a different body because this is too much to bear. And so my husband and I are pissed. We're absolutely enraged right now because no one's able to do anything for her. And the screaming happened so badly that the EVD site that was sutured, where the pseudomeningocele had been developing, ruptured. So now we have a drip outside of the skin. The CSF is now leaking outside of the head, and right away I paged neurosurgery. We were feeling a little bit of oomph there, and so they paged neurosurgery, and Christian came down. And Christian is one of the neurosurgeon residents, and he's verified that there was a leak, that the pseudomeningocele had ruptured a bit and the CSF was coming out. He put a gauze over it, taped it up, and we would end up needing to go into PICU again, because now that the CSF is leaking, there's a risk for infection, and risk of infection to the head is not good, right? Anybody could tell you that. That's not the ideal situation. That's not any situation that you want, ideal or not, right? So now we're back in PICU, and this will be the time that Amity receives her first lumbar puncture. And the lumbar puncture is basically when baby's laying down on her belly, they come toward the bottom of the spine, and it's like a tap, right? Like tapping syrup out of a tree kind of thing. And they remove some of the CSF and they'll send it out for cultures to test for infection. And so that's what happened. And that is why we had to be back in PICU. Because of the risk of infection and the Amity's situation, we needed to get that CSF, sent out for cultures to verify that there was no infection and continue monitoring her in the pediatric ICU. And so the pseudomeningocele would only grow and get significantly enlarged over the period of the next few weeks, which would then be what prompts us getting a VP shunt placed, which will actually be on the other side of her head, but we'll end up getting a VP shunt placed November 4th, so that's quite a bit of ways. But the pseudomeningocele was not, these dogs, was not getting any better. Fortunately for her, there was no infection at this point, which thank goodness. But we spent quite a few days in PICU not really knowing what was going on. We didn't understand why we were in the PICU to begin with, when we thought we could just be on 3. And not that it's bad to be in PICU, because we love PICU, but there's just so much confusion about what's happening and not always feeling so informed. And so when we had spoken to Dr. Morse, who, again, if this is the first time you're watching this, Dr. Morse was Amity's pediatric neurologist. She had said, she was talking to us about what was going on, and we said to her that we have no idea what's really going on. We're kind of confused about what's happening and getting a little bit frustrated that we don't know what's happening. And at this point, she had introduced us to Dr. Bob. Dr. Bob is one of the most amazing... Dr. Bob, he is wonderful. And not that I want anybody to ever have to need Dr. Bob, because Dr. Bob is the palliative care doctor. He just changed everything for us. We just felt so supported. He would come to Amity's room twice a day, 6 days a week, and he would talk to us for upwards, like, if we kept him there, he would stay there. I mean, we would keep him there for like half an hour, 45 minutes sometimes. And between him and Kathy Herman, who works right alongside Dr. Bob, they were just always there for us. They were incredible. They both came to Amity's memorial. They're just very special people. And so Dr. Bob would get involved, and it was very clear, they wanted it to be clear to us that just because Dr. Bob from palliative care is becoming involved with Amity and us now doesn't necessarily mean that Amity's situation is terminal. They didn't want us to think that things were happening faster than they were. That was okay with us. Dr. Bob changed the game for us. I felt like he was our advocate, as well as our informant, right? So, like, if there were things that we weren't understanding, if Dr. Shimoni would come in and talk to us about something that was happening with Amity and the neuro side of things, if we didn't understand things, we would always ask him questions, but then we would still talk to Dr. Bob about it and get his opinion on the matter and see where his thoughts were on it. And if there were things that maybe came up in conversation that we didn't necessarily think maybe we understood, then he would go back to Dr. Shimoni and talk with him about it. And he just really kept things in check for us, basically. He was our, like, gatekeeper of information. Absolutely amazing. And if you ever need to work with Dr. Bob, you will not be disappointed. Gosh, he every time he would leave the room. Now, mind you, I said twice a day. I'm not exaggerating that. He would work 6 days a week, and he would be in our room twice a day to check on us and to talk to Amity. And every time he would leave, he would always say, "Mom and Dad, she's beautiful." It's just like, he's just the best. And she is beautiful, so he's not wrong. But this would be when we meet him and feel like pieces of things are starting to actually fit together, and that maybe we're understanding things. And he was between him and Kathy, they were the two people that we felt like we could truly express our frustrations, in hopes that something would happen, and that he could advocate for us if others weren't hearing us. And so it was very important to have him on our side throughout Amity's journey. because once chemotherapy would start and her G-tube would continuously become an issue, it was always good to have Dr. Bob in our corner. And he was someone who we absolutely expressed that we will not go home unless we were set up for success, for Amity, and that Amity is set up for success, because those 3 days that we spent at home, or 4, I'm sorry, we never wanted to experience again. And we never wanted her to experience them again. So we he was just awesome. So anyhow, okay, so we're still in the PICU at this point, and if you can remember, I had shared before that in PICU you're not allowed to hold your baby while you sleep, for, you know, it's the PICU, it's dangerous, I get it, but Amity was still not sleeping in the crib at this point, and so like 12:30 at night generally, anywhere between like midnight and 1 o'clock-ish, I'd say, I was headed down to the hotel to get some sleep, because here's the thing. Anybody who knew Amity knew that if mommy was around, that's all that mattered, and if she knew I was sleeping on the couch that's in that room, she would just cry and cry and cry. You couldn't have someone hold her and then you sleep on the couch, because she's not just going to fall asleep on that person because she knows I'm right there. So I would actually literally have to leave the room in order to get some sleep, and that's hard for me because I'm always there for her. So it's not like it was an easy thing for me to do, to leave her every night while she was in the PICU, and I hated it. I hated it. But I'm no good to her if I'm not getting any sleep. So one of the nights, Liv was her night nurse that night. I think Liv was, or maybe Liv was just hanging out with her. I don't know. Everybody loved Amity, so it was really nice. I knew that I was leaving her in good hands, of course. It just, it's still hard to leave her. But anyhow, Liv was with her this night, and God love her. Liv, we love you. She basically had Amity on her hip the whole night. They hooked her up to the portable monitors, had her out at the nurse's station hanging out. She was actually eating on like popsicles and ice cream and stuff through the night. But you know, none of that sounds like sleeping, right? So it was expressed to Dr. Scarlett then at the time that maybe Amity needs some help with sleeping, since, you know, she's not really getting any, and the nurses can't just like carry her around all night when they have other patients, and I totally support that. I get it. But I also can't put her in the crib to sleep because she's not doing that, and I can't stay up all night. So we were just up against it. So Dr. Scarlett had said to us the next morning, you know, what do you guys think about maybe getting Amity some sleep help? Like, okay, I mean, she's not slept ever since she was born, so I guess anything is helpful, right? And so I said, I don't know, because we've tried melatonin before. And she said, no, I'm not thinking melatonin. We're thinking something stronger, because I don't think melatonin's going to do anything for Amity. And so Dr. Morse, who is our pediatric neurologist, specializes in sleep medicine. And so she would end up coming in again from a sleep perspective now and helping us create a cocktail of sorts of medication to help Amity sleep well. And children with brain tumors are notorious for having sleep difficulties, obviously, right? The tumor itself can be interrupting certain REM patterns and everything else, and honestly I don't really know all the details about it, but I know that brain tumors can affect a child's ability to sleep. And so she would come in and start helping us find our sleep success, though none of it was ever really successful. It was better. It was absolutely better, 110%, but nothing was like a cure-all. And, you know, I guess that's, no one sleeps straight through the night without having tossing and turning, and you know, children are prone to waking up 4 to 6 times a night, kind of thing, and just being able to put themselves back to sleep. Amity wasn't able to just put herself back to sleep, and so that would end up being what we battled most once we got the sleep medicine involved, which we couldn't live without it, honestly. You know, then we were just battling her ability to learn to fall asleep on her own, not necessarily that the tumor was keeping her up all night or anything. So it was definitely better. You know, I went from being up for hours on end to waking up 6 to 10 times a night for you know, 10 minutes here and there. So improvement. But this was helpful for the nurses in PICU. And it was also helpful for me once we moved up to Children's 3 and she was sleeping on my chest, for her to be getting more restful nights of sleep, even if it was on me. Because her getting more restful nights of sleep meant that I was getting more restful nights of sleep, even if I was uncomfortable. So we found some success in that PICU stay, having that happen. During this PICU stay, we would also end up meeting Dr. Johannes. So the pediatric hemonc team, which is our hematology and oncology group or team, there's 3 doctors that are on rotation. We met Dr. Miller at the very beginning when we found out about Amity's tumor. We met Dr. Ramdas when he told us about Amity's diagnosis. And now we'll meet Dr. Johannes, who would end up being the one who's discussing with us what the chemotherapy treatment plan would be. And so Amity was going to be receiving 4 different chemotherapy medications: etoposide, vincristine, cyclophosphamide, and carboplatin were the 4 chemotherapy medications that Amity would be receiving on rotation. And it would be 2 21-day cycles, receiving treatment for the first 21 days on days 1, 2, 3, and 8, and then on the second 21-day cycle would be on days 1, 2, 3, 4, and 8. I might have actually gotten that backwards. I think it would be 1, 2, 3, 4, and 8, and then 1, 2, 3, and 8. So it's kind of crazy how that works, right? Because she's actually only receiving actual chemotherapy medication through her Mediport for 8 days out of 42, but the way that they run through your system and things like that ends up being that length of time. So we learned a lot from Dr. Johannes about what the chemotherapy would look like, the side effects, symptoms, things like that, blood counts, platelet counts, things like that we would never have known about otherwise until you're someone who is having to go through a chemotherapy treatment or be the one who's caring for someone going through chemotherapy treatment. So she would end up receiving a blood transfusion in the coming future here within October. She would end up receiving a platelets transfusion because of her blood counts being significantly low. But she did really, really, really well during chemotherapy. And so that'll be future stuff. I'm not going to get into a lot of detail about that now, but she's a freaking all-star. I mean, honestly, we had just the best baby. She's my absolute hero, and a lot stronger than I would ever be going through what she was going through. And so that kind of encompasses, 5-6-ish days of what we were going through at home. And then I'm sure there will be more videos in the future because the G-tube / GJ tube, because you'll hear me say both because Amity ended up having both, were unbearably problematic. And so I don't want this video to go on forever, I suppose. So that will be another video. As well as maybe some discussion on her VP shunt and her second Mediport surgery that she would end up having. But yeah, that's kind of a lot. I know 45 minutes worth of a week's time for us, but a lot to share and things that would build up and kind of explaining how some of those processes would occur for her and what those plans would look like moving forward. So we would end up being in the hospital for weeks for this admission. What was supposed to be a 1 to 3 day stay turned into nearly 4 weeks. And so there's a lot to share for the rest of this admission. So as always, I just like to say that I'm so thankful, as is my family, for all of the support that we've continued to receive even after Amity's passing. The amount of love that we get from everybody, every time I see on Facebook, there's always messages and comments and just people who love Amity, who didn't even know Amity, it's remarkable to me. She's truly the most amazing little baby. she's shown such perseverance through all of this and didn't let anything stop her, even when she was in such pain. She's amazing. So also, you might have seen my little, that's her hand. Isn't that just the sweetest thing ever? Oh my gosh, I love it. And so her hand is on my hand, because maybe I've definitely posted things like this before, I think, but she just always wanted to hold my hand. And so this was, as soon as I saw it, I had to have it, so that I could feel like she's still holding my hand, and with me. And this is her cremains bracelet, so she has some cremains in here. So